All right, good morning, everyone. So today we are reporting 558 new confirmed cases and 24 new probable cases of COVID-19 in the state. We do have 46 new hospitalizations and 3 new deaths, 1 each in Buffalo, Marshall, and Minor County. We have added 337 individuals who are newly recovered and no longer able to transmit COVID-19. And we have added a total of 4,666 new tests to the Department of Health reports. This does bring our COVID-19 case totals to 34,031 total confirmed cases and 1,013 total probable cases. Now, of all of those, we have 8,688 active infections, and we have had a total of 26,023 individuals who have recovered. We currently have 332 individuals hospitalized, 333 deaths, and a total of 380,661 total tests that have been reported since the start of the pandemic. And those have been received on 236,250 unique persons. Do have just a quick update for the clusters. We have currently at the Mike Durfee State Prison 8 individuals who have recovered out of 171 COVID-19 cases among staff and inmates. And then for some just information around COVID-19's impact in the state. So when we do look at the data, we do see increasing hospitalizations and deaths with age. For older adults, 60 years and up, they make up about 20% of all cases, but account for a total of 59% of all hospitalizations. That's in a comparison to children and young adults under the age of 30, who make up 35% of cases, but only 8% of all hospitalizations. For the deaths that have occurred in the state, we have not had any deaths reported among children birth to 9 years of age or those in the 10 to 19 years of age. And our highest rate of death is among those who are in their 80 and older population. So 12.3% of all cases in that age range have died from COVID-19 and its complications. Now, the one thing I do want to add, since we are seeing increasing COVID-19 transmission in the state, is that no matter your age, your risk for severe disease is not zero. Everyone should take appropriate precautions to keep themselves and their loved ones safe. And I like to use this idea of the Swiss cheese analogy. So, we're all focused on reducing COVID-19 in the state by using several layers of interventions or prevention activities. And with that Swiss cheese analogy, you have those interventions, such as staying at home when you're sick, covering your coughs and sneezes, washing your hands, avoiding crowds, wearing a mask, but none of those individually are perfect. They all have holes. So if you stack up each of those interventions, those holes start to cover, and the layering of those imperfect interventions can similarly slow down COVID-19 transmission in the state. And this is something that we discuss a lot when we're talking about influenza. Now kind of using that same analogy when it comes to COVID-19. So, Secretary Malsamaris.
Great. Thank you, Dr. Clayton. I'm happy to report that we're rolling out a new tool on the website today to help individuals better understand potential risk factors for poor health outcomes if they do become infected with COVID. And so on the covid.sd.gov website, you will see a link to what's called the COVID Age Risk Calculator. This risk calculator is a tool that can help people understand those potential poor health outcomes if they become infected, and it allows individuals to enter individual risk factors to better understand how those risk factors could in fact interact with COVID and lead to poor outcomes. Some of those risk factors include things like underlying health conditions, BMI, smoking status, weight. And the way the application works is that once you enter some of that information, it will help you see how those particular health impacts either add to or decrease your age if you were to get COVID. This is an anonymous application, so you don't enter any identifying information, and data from this will never be shared or sold with anyone. It's used to help individuals just better understand their particular situation. The reason we're putting this out is because we want people to understand that there are some modifiable risk factors to health that do play a role in overall health status and wellness, as well as contribute to poorer health outcomes if you do get COVID. And so we really, as the Department of Health, want to see people, make good choices as it pertains to diet, exercise, and other healthy habits such as managing stress and sleep habits. As we have since the beginning of this pandemic, we want to get good information out to people in South Dakota. We want to share the facts around COVID, and we want to give people the tools that they need to help manage their risk factors as it pertains to that. Again, as Dr. Clayton's mentioned, people need to continue to be vigilant. They need to do the actions that they can to minimize the spread of COVID. That includes that social distancing, staying home when you're sick, wearing a mask if you can't stay away from other people, and good hand hygiene. The tool that we're rolling out is based on research that's been published by the CDC and other experts, and you can find links to that exact research within the application itself. We also have links to certain services that people might be interested. For instance, if people are smokers, they can get information about the South Dakota Quit line for information about how to quit. The other information that I wanted just to update the group on is the importance of influenza vaccination. And so as people are aware, thousands of South Dakotans become infected with influenza each year. We do have effective vaccination for influenza. Again, it's not perfect, but it is one of the best tools we have to mitigate influenza in our state. And that vaccination helps people not contract the flu, or if they do, to minimize its impact and reduce the need for hospitalizations and deaths. With COVID circulating, obviously it's more important than ever that we pay attention to influenza so that we aren't seeing people, potentially becoming sick with that and needing hospitalization. We've got plenty of influenza vaccine available in South Dakota, and so far we know South Dakotans are stepping up. And so really want to see as many people become vaccinated by the end of October as possible so that we've got good protection going into those winter months. And just in terms of some of the numbers, last year we saw more than 15,000 cases of influenza in the state. Over 500 people were hospitalized from influenza last year, and then we saw 33 individuals die. So influenza can be very, very serious. Each year does look different, but we need to be vigilant against influenza as well.
All right, with that, I will unmute our lines and we'll take your questions.
This is Jackie with SDPB.
Go ahead, Jackie.
Hi, thank you. I have two questions, one about testing and one about contact tracing. My first question about testing, I know our goal every month is to test 5% of the state population or an equivalent of that. We have been testing significantly more than that, I know, but I'm hearing from some local experts saying that our goals should be even higher than they are, something closer to maybe even 5% of the population per day. I'm wondering if the state is planning to increase its testing goal, and if not, why not?
So, Jackie, thank you for that question. As I think we maybe talked about last week, the 5% goal comes from the federal plan that we submitted here several months ago and represented more than 2.5 times what that federal guideline was relative to testing the population. As you point out, we have definitely surpassed that in recent months, and so far this month, no change in that trend in terms of seeing more testing. We are actively working to make sure that any symptomatic person in the state has access to a test, as well as robust sentinel testing among asymptomatic people, particularly in high-risk situations, so that we can, contain COVID, that we can know about it, contain it, and protect people from it. So you will continue to see us well surpass a 5% mark in our testing volume in the state.
All right. So just to clarify, no plans to increase that testing goal?
Again, that testing goal is tied to the federal plan that we had to submit, and so as we are looking to make changes to that plan, we would entertain changes in those numbers as well.
I see. And then just quickly about contact tracing, I wonder if you can update us on how many contact tracers the Department of Health has on staff right now, and any efforts to kind of close some of the gaps that we keep hearing about people not receiving any calls from contact tracers.
So thank you for that question. We can follow up with you on the specific number of contact tracers. I don't have that at my fingertips right now. We are actually onboarding another group of National Guard members to assist with our investigation and contact tracing efforts. But as you know, we have dramatically increased from the 20 individuals that we had prior to COVID to, well over 300 people kind of working to support this effort. Just a couple of notes in terms of how we do conduct those investigations and then the subsequent contact tracing. We prioritize our investigations to include K through 12 students and teachers, people that are over age 65, people that are living in settings such as long-term care or other congregate settings that pose high risk. So correctional facilities would be a good example of that. And so we do continue to prioritize those populations. When we are doing the contact notification, so again, those would be the close contacts being notified. The household close contacts of those individuals are handled by the investigator. And so those are done right away when the investigation is done. And then for other contacts that would not be in the household, maybe workplace or social contacts, the National Guard contacting those individuals. We do see some situations where the lab result perhaps does not get to us in a timely way, or where we make multiple efforts to contact a person and we're not able to reach them within a week's time. And at that point, then we notify those individuals by letter because remember the guidance is for a positive case to isolate for 10 days after their symptoms start. And so if we're not getting a lab result for 7 days, then, the point of contact tracing is smaller. And so that's how we handle those processes. We do also have the ability for individuals to help us, expedite those processes by doing an online survey of their close contacts. And so that has been helpful for us to get through some of those notifications, in a timely way as possible. We'd like to see more people taking us up on that option, and so we'll continue to work through that. And we're actually working to enhance that part of our contact tracing and investigation process as well to make that easier for people to work with.
Next
Thank
question.
you.
Jacob with Dakota News Now.
Go ahead, Jacob.
Hi, I just got a question, kind of twofold as well, but Wyoming just went to at-home testing that is saliva-based, and I'm just wondering if here in South Dakota, at-home testing and also saliva-based testing could be a possibility here in the future, or if that is something we're looking at to use in the future. Why or why not?
Yeah, Jacob, that's a great question. And in fact, we're currently in contract negotiations to make at-home saliva testing available for close contacts of positive cases, household close contacts of positive cases in South Dakota. And so saliva testing is, the saliva testing that we're looking at is PCR-based, which is considered that gold standard of testing. And so it is both very reliable and valid, and so we know that that's a good way for us to expand our testing options in South Dakota. we also know that people find that method of specimen collection to be easier to accommodate versus some of the other types. And so we think that's going to be a good option for folks in South Dakota, and we're looking forward to updating you with more details very soon.
Is there a timeline on that? Sorry.
Yeah, we're negotiating the contract this week, and so I think next week we can have more of a timeline in terms of when people will start to see that. We've been working on kind of a parallel track to get some of the technology in place for how that will work, and I can just give you a preview of that. What that will be is if there's a person in a household of somebody who's positive, who is identified as a close contact, they will be provided the option if they would like to get access to at-home saliva testing. If they say yes, we will provide them with an individualized URL code for them to go online, order their test. The test will be sent to them upon their request, and then they will go through the specimen collection process and then mail that test back. So those are some of the processes that we've been working on to make sure that as soon as we've got that contract ready to go, that our back-end processes are ready as well.
Next question.
JP, KORA News
Charles,
Radio.
KELOLAND News.
We'll go to JP, and then we'll go to KELOLAND.
Thank you very much. Regarding the contact tracing, just a couple of questions there. Number one, what hours are the contact tracers working? And number two, is this going on 7 days a week?
So JP, yes, we do have investigations and contact tracing happening 7 days a week, and they are working from 7 to 8 a.m., depending on your time zone, to 7 to 8 p.m. Every single day.
So that should help just to make sure that people would, if they get a call from you, they should be especially vigilant during those particular times.
Yeah, and again, to call us back when we leave you a message and, help us help you with getting the right information so that you can keep yourself and others safe.
Thanks.
Now we'll go to Kello.
Thank you. So the CDC recently just released 8 things to know about vaccine planning. I was wondering if you've been working with them, and once and hopefully when a vaccine does come out, how do you plan on distributing that?
Great, thank you for that question. We have submitted our first draft vaccination distribution plan that was due to the CDC last Friday, and so we submitted that then. It is currently being reviewed, and once we have that review done and any potential changes made, we will be posting that, so we'll be able to talk more about some of the details about that. What we anticipate is that the first allocation that the state will get will be very limited in the number of doses, and so we will be prioritizing consistent with what the federal recommendations are to focus on high-risk healthcare providers so that we can continue to provide needed healthcare to people across our state. As the vaccine allocation becomes more robust, then we will be able to branch out to include all healthcare providers, including EMS and other kind of essential workforce in that vein. We will be branching out to long-term care facilities. Long-term care facilities across the state will be working with different entities to help with their vaccination efforts, and they have some choices to make around that. And then once we get through long-term care residents and then other high-risk individuals with underlying health conditions, we anticipate the vaccine availability will become quite broad, and then the rest of our population will be able to access the vaccine much like you do any other vaccine. And so that would be through pharmacies, through your doctor's office, through community events. We've got a lot of community drive-through influenza vaccination, events happening, and we would anticipate those opportunities to happen for people with COVID as well.
Next question.
Angela Kennedy from
Kello.com News.
Go to Angela first.
Is the state tracking how many patients contract
Yes.
COVID-19 more than once? And if so, do you have the numbers on that data?
So this is Dr. Clayton, and we do keep track of all of the test results that come in on individuals, and so we do have the opportunity to investigate anybody who has a positive test. Now, the process for that is that upon the first positive test, the investigation is conducted. Any subsequent positive test within 90 days is not investigated, and unless there's a specific concern on the part of the medical provider that person may be reinfected. After 90 days, those individuals are further investigated according to CDC guidance for those reinfections. And for CDC to consider a person reinfected, they do have to meet certain criteria, including having the capability of looking at the level of the viremia that a person has, that is somewhat detected at the time of testing, as well as the ability to differentiate the first test from any potential new virus, or any sort of potential genomic changes in the virus. So there are some pretty steep criterion around that, and at this point we have not identified any individuals in the state of South Dakota that have kind of met all of those criteria. That does not mean that we don't have individuals that have been suspected by their clinicians or have had positive test results after that 90 days, but none of them have met the full CDC criterion at this point.
So does that mean they had it twice, or they didn't have it more than once?
So at this point, we have not confirmed in the state of South Dakota that an individual has been infected twice.
Thank you.
Next question.
Todd Epp, Color.com News.
Go ahead, Todd.
Thanks. With the holidays coming up, Thanksgiving, Christmas, New Year's, Hanukkah, so forth, do you recommend, Dr. Clayton and Secretary, you recommend travel for South Dakotans, and are you yourselves and your families going to be traveling between now and the first of the year?
So I think that's a very good question, and it should be on people's minds as they're thinking about what they're doing for the holidays, their travel plans, and what impact that may have. So as I've mentioned many times on these calls, when we have individuals that are coming together, that does pose a risk of COVID-19 transmission. Symptoms alone does not identify a person with COVID and their ability to transmit the virus. And so because of that insidious nature of COVID-19, it is important that individuals be very conscious about the decisions that they're making. Now, your question is timely because I just had this same discussion with my mother that, we're in a wait and watch approach for whether my family will be traveling for the upcoming Thanksgiving holiday. That's something that, we're deciding on based on the level of transmission in the state at the time, based on, any potential exposures that family members may have, and a lot of other factors of whether, we will actually make a trip to visit family during the Thanksgiving season. And I think all individuals in the state need to take that into account when they're considering, what they're going to be doing. Now, that doesn't mean that you can't have family time. I mean, you can create new traditions. So just keep that in mind, and if you would help get that information out to people that they do need to be taking an active consideration, what they will do for the holiday season.
And Madam Secretary, are you going to go anywhere?
Well, we're actually in a similar position as Dr. Clayton. We are continuing to kind of watch what's going on and seeing how our family's doing. Thankfully, our family is all in South Dakota, and so if we were to travel, it would not be much further than where we live. But yeah, especially when you've got older family members that would be part of those kinds of celebrations, we just want to be really careful and protect those folks.
Festivus just isn't the same if everybody's on Zoom.
It isn't, especially depending on who's doing the cooking.
Yeah, thank you.
Ray from Coland.
Stephen Gross from the AP.
We'll go to Ray and then to Stephen Gross.
Hi, yes. Last week at a news conference in Sioux Falls, the governor mentioned that the National Guard hospital beds were at the ready or could be assembled very quickly. Is there an anticipated need that those beds could be used, or what's the status on that?
Well, Ray, the status this week remains the same. They are at the ready, but our systems and our hospitals across the state are currently meeting the need. That's both of people that have COVID and need hospital services, and then other people that need hospital-based services. So we do not have a plan to call those beds up at this time, but if we do in the future, we're confident that they'll be ready.
Now we'll go to Stephen Gross.
Yeah, I was just wanted to ask a question about calculating test positivity rate. I had noticed a significant discrepancy between the way the state calculates test positivity rate and places like Johns Hopkins. It seems to have to do with the way the denominator is calculated. I was just wondering why the state decided to go with the calculation that it did, and then in terms of calculating new people tested, how often do you see people receiving multiple tests within the span of several days or the course of an illness?
So the first question around the test positivity, so the South Dakota Department of Health does fall in line with how we calculate both the numerator and denominator for that percentage. According to CDC guidelines as well as Center for Medicare and Medicaid guidelines. I understand that there are other folks out there, such as Johns Hopkins, that calculate it differently. They have their justification on their website, and that's perfectly fine. Just individuals do need to recognize that there are going to be differences from some academic centers, from the federal government and from states.
The other thing I would mention, Stephen, is that Johns Hopkins doesn't have the full data set from states, and so while they may have a different methodology to calculating that rate, they also do not have all of the data, which I don't think would be surprising of academic centers just wouldn't have the same access as the federal government does. And I can tell you that our test positivity rate, as Dr. Clayton said, is in line with the CDC test positivity rate for South Dakota.
And as far as your second question, individuals and their potential for retesting, we don't see a lot of retesting of individuals who have already tested positive. Where you might see some of that is individuals who had an antigen test first, and the clinician does want to confirm the result of that using molecular-based testing methods such as PCR. You may also see that on individuals that are being tested by their clinician, to help monitor their situation and how much of their ongoing illness is due to COVID-19. What we do know is that individuals can remain positive for quite some time on the PCR test, which is very sensitive and which is the gold standard test. But the individuals who are otherwise normally healthy do recover and are released from isolation within 10 days. And then those who are severely immunocompromised or have certain underlying medical conditions, are released from isolation at day 21. So even though there are individuals who are being retested, that does not mean that they are, it's a full continuation of their illness, and it's done for a various number of reasons.
And sorry, just so for my understanding, when we see the increase in the total number of tests and then the increase in the total number of people tested, so here's a scenario. I got a test a month ago, and then, I have a reason to get a test this month, would that mean that I would not add to the total number of people tested?
So, you are correct that your second test, would add to the total tests that we're reporting, but it would not add to the number of unique persons that we're reporting on the website.
All right, we have time for one more question.
Morgan at the Rapid City Journal.
Go ahead, Morgan.
Thanks. I have questions about contact tracing. Have any hospitals offered to help keep up with the tracing? And also, another thing is that North Dakota told their own people who are sick to do their own contact tracing this week. Would South Dakota ever get to that point? Or, I don't know, is that just something people should do anyway to let their close contacts know? Can you respond to that?
Sure. So we encourage providers. So you all will recall how people find out about the results of their COVID test. They hear from their provider first, whoever ordered that test. And so we encourage providers to obviously provide guidance to individuals who are positive about the need to isolate and the time period for that and how to do that effectively. We also do encourage people to start thinking about your close contacts and let them know so that they can, start to quarantine, if necessary. And so that's a pretty typical process that we use verbally, and then again through our processes follow up if it's within those time periods where we can do that. What was your first question again, Morgan?
Just if any hospitals or healthcare providers have offered to help you guys keep up with contact tracing.
Yeah, we've had various conversations with a lot of different entities. We're actually working with one group in one particular community right now. I don't have enough details to share much more about that, but we've got, tribes that are doing some investigation and contact tracing. We've got certainly healthcare providers are helping to advise their individuals. Schools are playing a role in helping to identify potential close contacts. So we work with a variety of entities to kind of get that job done, including healthcare providers.
And this is Dr. Clayton. I will say that, with medical professionals, especially when they're working in the hospital setting, it's usually the employee health, that is helping identify individuals who may have been exposed, to patients or to, others that may be in that healthcare setting. And so we work very closely with them as we're identifying those cases.
Right. The same would be true for long-term care settings. So it's a pretty collaborative process in many ways.
Do you have time for one more?
Sure.
Okay, it's Ray from Kellerland again. You've mentioned doing saliva testing and those kinds of things, but the focus seems to continue to be on close contacts or vulnerable population. When you look at Wyoming, for example, they're sending test kits home for everybody to do, whether or not they're symptomatic, whether or not they're in close contact. Minnesota's moving toward that, and Iowa is also reprioritizing to say, if you've got community transmission, we're going to let you go to some of these testing places. So just asking, is South Dakota going to move that way at some point? Because we seem focused really on close contacts and vulnerable populations.
So, Ray, in terms of, the saliva testing can be done in several different ways, okay? So in terms of the at-home testing where the state of South Dakota wants to make that an option for individuals, we will be focusing on those household contacts of positive cases, and that's because they're a priority population so that we can slow the spread of COVID because they are, likely to be exposed and likely to be positive. In terms of other saliva testing options, we anticipate those to be more readily available, not related to being a close contact of a positive case. And those would not be necessarily mailed to a person, but some other options of getting that saliva testing out there to people.
All right. Thank you for